Collaborative care has decades of evidence showing that it's an effective delivery model for integrating behavioral health into primary care. The problem is, there's a lot of administrative burden to delivering collaborative care. Things like PHQ-9 having to be completed over the phone, how long it can take to be able to actually fill up the registry and get the amount of patients you need to make it cost effective can be a real challenge. I think the biggest misconception about collaborative care is that it's going to be a burden on the primary care provider. They think, oh, this is just going to be more work for me. Now I have to treat these mental health conditions on top of the laundry list of other requirements that I have to do every single day. Well, the truth is, when we roll out with collaborative care, what we hear from primary care providers is that they are so grateful. They felt adrift at sea without a life preserver before. They had to treat these conditions. They'd have the patients in their clinics for 45 minutes, trying to find the right resources for them, feeling powerless. Now, having that really direct stream of knowing exactly where that patient can go, who to connect them with, and having the resources available really empowers the primary care providers. One of the challenges with collaborative care is really keeping track of the time element of it. So what NeuroFlow really makes easy is every time that care manager has an interaction with the patient, they actually include the amount of time that they've spent or did any sort of work with that individual. So we can actually use the logic and technology built in to make sure that we're building the right codes and maximizing the value of the collaborative care. What NeuroFlow has done is built a real top-of-the-class cloud-based registry tool where a care manager doesn't have to go anywhere. They're able to put in all of their notes, time track, flag patients for case review. They're using that trends and patterns over time to have a really efficient and effective case review with that psychiatric consultant. And then putting it all together, packaging what happened with this patient over the month, and feeding that directly into the EHR through our integrations or through our summary reports that really make it easy for that PCP to just get the information they need in order to get the outcomes we're looking for.